Interestingly, the World Health Organization's Director General has once again defended the agency, saying that it had sounded the highest level of alarm over the novel coronavirus early on. But not all countries had heeded its advice. Listen in to what the Director General said.
From the beginning, WHO has acted quickly and decisively to respond and to warn the world. We sounded the alarm early, and we sounded it often. We said repeatedly that the world had a window of opportunity to prepare and to prevent widespread community transmission.
Dr. Tedros Ghebreyesus said that the organization acted quote-unquote quickly and decisively. The Geneva-based UN body has come under mounting criticism in recent weeks, especially from its top donor, the United States, which has also cut off its funding for WHO's alleged pro-China stance. This after the US President Donald Trump constantly attacked China for not doing enough to contain the virus. So much so that Trump said the US was doing a very serious investigation. The White House has also blamed China for sending low quality of faulty medical equipment and testing kits. Dr. Tedros also acknowledged the problem of low testing in many countries. He said that they have trained 2.3 million health workers and shipped millions of test kits. According to tests, the number of people developing antibodies are very low, and this is a matter of grave concern. This means that a vast majority in this world are susceptible, even those who have recovered from the coronavirus. The WHO has also said that it is important to wait and conduct a phased lockdown. The transmission wouldn't stop unless easing of lockdown is only brought strategically.
But I would say that the general outcome, even in areas of fairly intense transmission, the proportion of people who have seroconverted or who have antibodies in their blood is actually quite low, which is a concern because it does mean the vast majority of people remain susceptible. So the chances of disease rebounding or returning is quite high, especially if control measures if control measures or lockdown type measures are released too quickly without being replaced by case finding, contact tracing, testing and strong community compliance.
This pandemic has changed the way we have lived our lives, and it seems this change is going to stay for days to come. What Dr. Tedros calls is a new normal has changed the way we see physical and social relationships with each other. The WHO chief even said that we all need to start living our lives knowing that the virus is present, and the world could take a lead from Sweden.
I think if we are to reach a new normal, I think in many ways Sweden represents a future model of, if we wish to get back to a society in which we don't have lockdowns, then society may need to adapt for a medium or potentially a longer period of time in which our physical and social relationships with each other will have to be modulated by the presence of the virus. We will have to be aware the virus is present, and we will have to, as individuals and families and communities, do everything possible on a day-to-day basis to reduce the transmission of that virus.
The WHO has also started delivering personal protective equipment and more testing kits to 51 countries on the African continent. Dr. Tedros also assured that over the coming few weeks to come, there will be a huge scale-up in terms of automated tests, manual tests and swabs. About 140 countries are on a priority, and middle-income countries will receive the PPEs first.